Chapter 28, Substance-Related Disorders. Today, in the drug-producing countries of Central and South America, growing cocaine is the only means of making a living for many of the farmers. Prices for cocoa leaves far outweigh the money paid for corn, wheat, or any other agricultural products. Illegal substances or substance for abuse can be ingested in multiple ways. It can be orally, like alcohol, intravenously, when someone shoots into their vein, nasally, inhaled, often may be called huffed, or eaten, as in placing marijuana in the form of a candy or in brownies. An example of habituation is when an individual will take Restoril every night before they go to bed because the individual believes they cannot sleep without it. An example of substance dependency is when an individual takes Valium 3 times a day and occasionally they will skip a dose. Then they report that they become shaky, anxious, or nauseated. An example of addiction is an individual that has tried to stop smoking multiple times, but states that they just cannot do it. Every chemical that is ingested by a pregnant woman poses a threat to her unborn child, especially during the first trimester of pregnancy, when the fetus that is developing is highly sensitive. Chemicals that are taken in during pregnancy can seriously interfere with the normal fetal growth and development. They can also alter the placenta or interfere with its ability to perform the life-promoting functions. Fetal alcohol syndrome affects more than one child per 1,000 live births. Children that live with substance-abusing parents are at increased risk for injuries and becoming potential drug-addicted individuals. Adolescent substance use, abuse, and dependence is an ever-increasing problem. Adolescents often will depend on or rely on peer pressure, and this peer pressure can result in drug and alcohol abuse. There have become alcohol-free clubs and recreational facilities for teenagers and young adults to help them have a place to go that is safe and away from peer pressure. 10% of the nation's adult population regularly abuse alcohol. More than 40% of all the drug reactions occur in individuals that are ages 65 years and older. As a nurse, you should be alert to the possibility of substance abuse in older adults. Older individuals, especially those that drink, are often found to misuse drugs and prescription medication. As a nurse, we need to understand polypharmacy, which is using many drugs or medications at one time. And this is something that is commonly seen in individuals that visit different healthcare providers. The abuse of chemical substance presents many problems. Alcohol and drug abuse will affect every individual, both financially and in human costs. Millions of children who have alcoholic parents live within our United States borders. These children are 3 times more likely to have risk for serious injury compared to children of parents that do not drink. Financially, the United States spends more than $51 billion yearly to help battle drugs and alcoholism. Society's homeless and mentally ill individuals will often use and or abuse medications, drugs, or alcohol. Individuals that are homeless and are afflicted with any of these disorders are the most disadvantaged and underserved groups within our United States border. There are categories of abused substances. Underneath, it can be an alcohol or it could be an opioid. So it can be caffeine, which is a sedative, hypnotic, or analytics, cannabis, stimulants, hallucinogens, tobacco, inhalants, and we as nurses need to realize that a depressant will sedate the central nervous system. Stimulants increase the functioning of the central nervous system. Caffeine is considered a stimulant. It's an ingredient that is found in many products in the supermarket, and it obviously is the main active ingredient in coffee, black tea, colas, some other bottled beverages, and energy drinks. It is also found in chocolates, diet aids, cold remedies, and over-the-counter pain relievers. Cannabis is available in multiple forms. Cannabis or marijuana is a term that is applied to drug derivatives of the hemp plant. It grows wild in many tropical and temperate climates all over the world. The hemp plant has been used by many cultures for centuries in folk remedies and medicines. It has been used to treat pain. It has been used for decreased appetite, muscle and gastrointestinal tract spasms, asthma, and depression. It is also used as an antibiotic and a tropical anesthetic. Commercially, hemp is used for rope, clothing, and paper. A new synthetic cannabis that is known as a spice or K2 is now sold on the black market. Hallucinogens are natural and synthetic substances that will alter the perception of reality. The active ingredient of the peyote cactus, mescaline, has been used in religious ceremonies of Native Americans for many years, but lab-designed hallucinogens weren't introduced until the 1970s. Hallucinogens produce psychosis-like symptoms. Lysergic acid, or LSD, was discovered by accident in the 1930s when someone was researching ergot, which is a fungus that grows on certain grains. LSD is sold in tablet, capsule, and liquid forms. The effects of the LSD is called a trip and can last approximately 12 hours. Peyote buttons are disc-shaped crowns of the peyote cactus. These are usually chewed or soaked in water to produce a tea. The active ingredient is mescaline, and its effect will last about 12 hours. It is used in some cultural religious ceremonies. Psilocybin is found in certain bitter-tasting mushrooms which are eaten fresh, dried, or steeped into a tea. The hallucinogenic compounds are not inactive by freezing or cooking. The effects begin within 20 to 30 minutes and can last up to 6 hours. The reactions can cause convulsions and death. These are known as magic mushrooms. PCP was originally developed as an animal tranquilizer. It is a white, crystal-like powder that is smoked, snorted, or swallowed. When ingested, it will produce feelings of being separated from one's body and the environment, and it can also produce mild depression or a schizophrenia-like reaction. It is highly addictive, and long-term abuse can result in memory loss, weight loss, depression, and problems with thinking and speech. PCP is a dangerous drug because it causes individuals to behave in an unpredictable and often violent way. Opioids, these are strong pain relievers. They have specific pain relieving properties and are used for medicinal purposes. These substances are referred to as narcotics or opiates. They're obtained by milking a flower, which is the opium poppy. They are prescribed for a variety of painful conditions, coughs, and diarrhea. Narcotics are central nervous system depressants. They can occur naturally, semi-synthetically, and synthetically. Some natural narcotics have been altered to make new, artificially produced medications. Natural narcotics are opium, and its principal ingredient is morphine. Pure heroin is white, a bitter-tasting powder that is usually put into a solution and then injected. Today, there are very potent forms of heroin. Some are strong enough that they need only be smoked or inhaled to produce the same effect as injecting. Street heroin can be found in a multitude of colors ranging from white to dark brown, and a new form, black tar heroin, is especially potent. Morphine is one of the most effective painkillers that we have available to use. It is marketed as a white powder or in a solution. It is administered by injection under the directions of a licensed care practitioner. Hydromorphone and its derivatives are semi-synthetic narcotics that are made from opium. A common brand is Dilaudid. It is used as an analgesic and produced in liquid and tablet forms. It is shorter acting, more sedating, and up to 8 times more powerful than morphine. Fentanyl is a synthetic opioid. It is 80 to 100 times more stronger than morphine, and it is used to treat severe pain medically. Cocaine is a street drug that is available as a white crystalline powder. It's commonly contaminated with a local anesthetic or sugar. It can be injected or snorted. Cocaine produces an immediate rush of energy, vigor, and feelings of well-being. These effects usually last less than an hour. These pleasurable feelings can lead to a mental dependency for multiple individuals. Crack is a type of processed cocaine. This combines cocaine with ammonia or baking soda, and heating it will remove the hydrochloride molecule and then produce chips or chunks of highly addicting cocaine called rocks. These can be vaporized in a pipe or smoked with tobacco or marijuana. Because of the concentration of the cocaine in the crack, it reaches the brain immediately and produces a greater intensity of high, but it is shorter lasting. Methamphetamine is one of the most addictive and destructive drugs that's available. It is available in bags of white to pale brown powder that is smoked, snorted, injected, or swallowed. Crystal meth is a more potent form of the methamphetamine. The individual will experience a rush of euphoria and well-being that can last as long as 12 hours. Nicotine is present in all forms of tobacco and some medications, like a nicotine patch or nicotine gum. It produces relaxation, increases alertness, and also can relieve feelings of hunger. Nicotine is frequently used to control body weight and is currently a legal inhalant. Alcohol is a central nervous system depressant. Large doses can lead to death and it becomes very addictive. Narcotics are central nervous system depressants, and large doses can lead to death and it is highly addictive. Stimulants will stimulate the central nervous system, which increases alertness, the metabolic rate, but can overstimulate the central nervous system, and stimulants are addictive. Hallucinogens will produce an altered sense of reality. These can result in flashbacks and mental health problems. Cannabis will produce a sense of well-being, alter time perception, concentration, and motivation. The designer drugs are mild hallucinogens that increase feelings, empathy, confusion, cause memory loss, decrease consciousness, seizures, coma, or death. Medications. These can either be central nervous system stimulants or depressants, depending on the medication. They are used for weight loss, metabolic problems, can be caused with misuse of laxatives or diuretics. Inhalants, these vary by the chemical property. They cause a loss of inhibition, slurred speech, a loss of coordination, muscle weakness, and can cause damage to the central nervous system that produces sudden death. The common practice of using an inhalant is to soak a rag in the substance, put the rag in a bag, and then put the bag over the nose and mouth and inhaling deeply. Inhalants are popular with young adults and adolescents because they're legal, inexpensive, and easily available, and the effects are a rapid onset. There are various theories as to why individuals use street drugs or become addicted to medications or street drugs. There is no one single theory that will explain why individuals are substance users and abusers. For stages of addiction, the early stage, the individual is able to use and enjoy the substance that they've chosen. They have a desire to repeat the first experience because it was pleasurable, and it can lead to a frequent pattern of use. In the middle stage, the individual may act angry, possibly become violent. They can be restless and irritated. They can be preoccupied while obtaining the substance. They could be anxious and shaky and go through withdrawal depending upon the substance. The individual will progress into late stages of addiction, and in these stages, the individual has alienated friends and family. They require more of the chemical because the tolerance for it has increased. They cannot tolerate living without it. Their daily life consists of taking the substance and planning how to obtain it. Their plans may include theft, prostitution, or lying, sometimes even murder. If the individual does not seek help for the addiction, they will ultimately end up in jail or dead. Intellectual, behavioral, and psychosocial changes will lead an individual to keep using the substance despite problems. These are the key features of abuse. Some nursing diagnoses that are appropriate for a substance abuser would be anxiety, communication impaired verbal, coping, ineffective community, coping, ineffective, denial, ineffective, family processes, dysfunctional, alcoholism, risk for injury, risk for loneliness, non-compliance, powerlessness, social isolation, spiritual distress, risk for self-directed violence. The three most abused types of drugs are alcohol and sedative alcohol combinations, opiate narcotics, chiefly heroin, and stimulants, which are the ones that are used are cocaine and amphetamines. The central nervous system. The nurse needs to assess for orientation, level of consciousness, balance, and gait, as well as to follow obstructions. For the head and neck, the eyes and pupils should be checked and examined. Note the complexion, any distended neck veins. Look for injection sites under the tongue. Inspect between the lips and the gums. Take vital signs. Ensure that you take the pulse, respirations for 1 full minute. Palpate distal pulses. Note any breathing difficulties. Listen for any heart irregularities. For the skin, look at any lesions or marks. Observe for any needle marks on forearms, fingers, legs, toes. Nutritional status. Note that many individuals that are chemically dependent are at high risk for malnutrition. So you need to ask your client to tell you everything that they ate yesterday. For their general appearance, you want to look at their dress, mannerisms. You want to note the rate of their speech, motor activity. You want to explore their alcohol use and understand that individuals that are abusers try to minimize the quantity of alcohol used. Have them describe the size of the container that holds their alcohol. You want to watch for signs of depression, emotional instability, anger, jealousy. Ask if they've ever had a hallucination or a blackout. Discover if they have any social support. You want to know the chemicals that they're currently using, how often, how much, when was their last dose. Do they want to seek treatment? And then there are some diagnostic tests that will be ran on these individuals, a CBC, urinalysis, and chemistry blood panel. These are done to assess for any organ damage. There are what may often be tests for hepatitis, HIV, tuberculosis. They will need to be assessed for any nutritional or bleeding problems. Sometimes a CT or an MRI may be performed, as well as an EEG. Methadone has been administered to ease effects of withdrawing from heroin and can be used to treat heroin addiction. Antabuse is a medication that is taken daily by non-practicing or dry alcoholics. Often, not only do people return to chemical abusing behaviors, but they also need to readapt to the psychological and emotional mindset that started the abuse in the first place.